Good afternoon. In the series of achieving sustainable development goals and going to moon, Mars, and beyond, we are at the stage of SDG3, good health for all and well being of all. Okay? Then we'll see targets and indicators, and of course, what are the post pandemic corrections which are required, and how to go to moon, Mars, and beyond. Okay? So, SDG3 indicates that we should get the healthy lives and promoting the well-being of all at all the ages. However, pandemic has generated health services disruption, enlarged the investment discrepancy, increased rich country and poor country disparity, and created data discrepancy, which got amplified due to lockdowns as well. Okay, so what are the problem of that has been the problem of disruption? What is there in SDG3? Due to pandemic, 90%, that is more than 170 countries, reported the disruption in their health services, and at some places negative impact on health, and also life expectancy also got halted, and some countries it has been reversed as well. Okay, next is problem of discrepancy. First was problem of disruption, now is problem of discrepancy. Investment in universal health coverage, USC, is still not enough. That we'll see in other goals, that all the developed nations have to donate almost $300 billion, but they have reached up to 168 plus billion dollars. So the that kind of discrepancy is also there. Problem of disparity. North America has 150 nurses and paramedics per 10,000 and 25 doctors per 10,000, while in Sub Saharan Region there are only 10 health workers per 10,000 and 2 doctors per 10,000. Okay, so that has been exposed in pandemic as well. Next is problem of data. Impact of pandemic is still unknown till December 2021 due to lack of data and problems in collecting data due to lockdown across the world. Okay, and these all data have been taken from United Nations website through various reports. Now, what are the targets and indicators in SDG 3? Target 3.1, to reduce maternal mortality by it is 70 per 100,000 live births, and we want to reduce it. Indicator 3.1.1, maternal mortality ratio, definitely. And indicator 3.1.2, proportion of births attended by skilled health workers. All these things should happen under the proper paramedic attention, so that the mother as well as children are saved. They get good, in fact, nutrition as well after. So that next point we are going to discuss that one. Target 3.2, by 2030 neonatal mortality to be reduced to 12 by 1000, and below 5 years age 25 by 1000. Means out of 1000, or only 25 death. In fact, there should be 0 death, but we are going to reduce it. Okay, at present. Indicator 3.2.1, age under 5 mortality rate, that is reducing the death of kids under 5 years age. And indicator 3.2.2 is neonatal mortality rate, that is reducing the deaths of newborn infants. Okay. Target 3.3, ending all the epidemics and communicable diseases by 2030, and in fact we faced it right now. We are under lockdowns. So not epidemic, but pandemic has impacted the whole world. Indicator 3.3.1, number of HIV infected per 1000. Indicator 3.3.2, number of TB incidences per 1000. 3.3.3, malaria incidences per 10,000 per 1000. And 3.3.4, number of hepatitis B incidences per 100,000. Indicator 3.3.5, number of needing tropical infectious diseases. Okay. Target 3.4, reduction of premature mortality of 1/3 of its value by promoting preventing preventive treatments and mental health and well-being as well. Indicator 3.4.1, mortality due to the heart diseases, cancer, diabetes or chronic respiratory diseases. Indicator 3.4.2, suicide mortality rate, means mental health wing is also being taken care. Target 3.5, strengthening all inclusive and exclusive prevention and treatment of substance abuse. It should stop in fact. Indicator 3.5.1, coverage of substance abuse interventions from psychological to the rehabilitation. Both aspects have been taken care. Indicator 3.5.2, harmful use of alcohol, that is per capita alcohol consumption within a calendar year. It's a very big problem. Target 3.6, reducing road accidents, including the death due to them, by 50% by 2020. Now, most of these require the course corrections. Indicator 3.6.1, death rate due to road traffic injuries. Okay. Target 3.7, by 2030, ensuring universal access to reproductive health care services as integrated with national program. Indicator 3.7.1, proportion of women between age 15 to 49 having access to modern safe methods. Indicator 3.7.2, adolescent birth rate age 10 to 14 years per 1000 and 15 to 19 years age per 1000. This problem needed to be targeted and solved as early as possible, because these ladies, going to be ladies, need to be so well defined and living that the next generation should be proper, in fact, living a proper life, achieving sustainable development, maybe going to moon, Mars and beyond as well. So that is why I suggest that 12th graders should be the marriage, that is the age. Beyond 12th grade only they should be able to marry, because they are reaching at age of 18th. Okay, 12th graders should be minimum education criteria, as we call them a literate. Target 3.8, achieving universal health cover, which with all inclusive population with affordability and reach at grassroots level. In indicator 3.8.1, inclusive coverage of essential health cover at the grassroots level, and even physically challenged people, etc. are also covered. Indicator 3.8.2, proportion of large household of health per total household income. How much they have spent on health and how much they are earning. Target 3.9, by 2030, reducing death and illness due to air, water and other hazardous material pollutions. Straight away. Indicator 3.9.1, mortality rate to household and ambient air pollution. 3.9.2, mortality rate associated with unsafe wash, WASH, water, sanitation, hygiene and all services. Okay. Now indicator 3.9.3, mortality rate associated with the unintentional poisoning. For example, fertilizer and insecticides have been sprayed in the agricultural land that gets due to rain percolated to so many places, and that poisoning is happening unintentional. Target 3.8, strengthening WHO framework convention on tobacco control everywhere. What is that? Indicator 3.8.1, age standardized prevalence age 15 and older, its present prevalence. Below that, no should be able to smoke. In fact, smoking is written over there. Smoking is hazardous and injurious to health. They should follow that. Simple. Target 3.B, supporting the research and development in medicines, vaccination, healthcare, and its inclusive grassroots level affordable reach at the bottom of the pyramid, with IPR taken care as per the Doha Declaration of Public Health. You might have seen that uh, in India it was, vaccination was at the free of cost, and the uh, I'm so proud of them. Most of the vaccination provider and the manufacturer as well, they they reduce it. If it was costing suppose $5, they reduced it to $1 or $2 price of their vaccination, because in fact they manufacture 100 million, some manufacture even 1 billion, 500 million vaccines. So that's where the IPR also can be taken care. In India, we reached 1.2 billion, almost, vaccination. I got my all the doses, 2 doses. Okay, so indicator of 3.B.1, citizens vaccinated per national population. Okay, indicator 3.B.2, total net provided to medical research and basic health sector in that nation. Indicator 3.B.3, proportion of healthcare facilities at affordable cost on sustainable basis. Okay, simple, these are simple. Target 3.C, increase in healthcare worker with full professionalism built in them, with post recruitment facilities and benefits, especially in poor states and island states. Indicators 3.C.1, healthcare worker density and distribution in that particular nation. As we saw it, that in Sub Saharan region only 2 per 10,000 doctors are there as citizens. It should increase. Target 3.D, strengthening the capacity of all countries for national and global health risk. Pandemic has proved this point so well that now revisiting SDG is required, and amalgamating them with the setting our concrete deadlines, our foot of human beings on Moon, Mars and beyond. We should follow certain things, and I'm sure we are capable. Human beings are capable to do that. Indicator 3.D.1, international health regulations and preparedness for all emergencies and exigencies. In fact, pandemic has prepared a lot of countries, though they disrupted and exposed the whole healthcare system, but still there is another side as well. Indicator 3.D.2, percentage of infections due to some of antimicrobial resistant microorganisms and other species as specified by WHO. So these are all indicators and targets for the target 3, SDG 3. Finally, let us assume that we are going to achieve the sustainable development goals, and then we go to Moon, Mars, then Earth 1, Earth 2, Earth 4, Earth 5. That is what my research paper said, and any dimensions. Then to whom they will follow? That our ancestors have done this, done that. It will be us. We are their ancestors. We are their ideals. So we should walk the talk. We should achieve the MDG at that time I said, now sustainable development goals, and should be able to go to Moon, Mars and beyond. With this concrete achievement, we'll be able to do better in future. If you have any suggestions, you are welcome. Thank you very much. Take care.